I'm Mary McTeague. I'm the Vice President of Patient Care Services and Chief Nursing Officer here at Trinitas. And I'm being joined by Dr. Michelle Shalankaro, the Division Chief for Medical Oncology, Dr. John D'Angelo, the Chairman of Emergency Medicine, and Dr. William Farrer, who's the Director of Medical Education. He's the Academic Chief for Infectious Disease. He's an Associate Professor of Medicine and also the Director of Epidemiology here at Trinitas. So we're really happy to have all of you along for this learning session about the COVID-19 vaccine, specifically from Pfizer. So welcome. We're up to 160 people on the call, so we're really excited to be able to present this information to you today. So Dr. Farrer, how about you get the conversation started? What do we know about the Pfizer COVID vaccine? And why are there 2 shots and not 1? And how does it prevent us from getting COVID?
Sure, thank you, Mary. This is a new type of vaccine, at least in terms of a vaccine for widespread use. It's called an mRNA vaccine. And without getting too technical, messenger RNA is genetic material that the virus has that's programmed to produce one of the proteins on the outside of the virus. You may have heard of these spike proteins. And there's no eggs, there's no tissue culture. It's a clean vaccine, which has a piece of this messenger RNA which has been modified so that when it's injected into somebody getting the vaccine, their body makes the protein and makes antibodies against this vital protein. Antibodies are what's causing the protection against the COVID-19 infection. And very clever design. It protects you by having you produce antibodies against the virus protein. And this protein is what the virus needs to infect cells, and it's being blocked by the antibodies. There may be other mechanisms by which it's causing you to be immune as well, but the antibodies are what's easily measured and focused upon. The vaccine was produced along with the other ones that are in development as part of this Operation Warp Speed. And I'll tell you that a month or 2 ago, I was a little unsure, a little suspicious about what kind of quality and what kind of scientific rigor there was in the production of these vaccines. But after looking through the materials, and the results of the big study were published in New England Journal of Medicine last week, which is one of the world's preeminent medical journals, I'm convinced, and I'll line up to take it myself. The results of the study were that those who got 2 shots of the vaccine, starting a week after the second shot, had a 95% reduction in the incidence of COVID infection. That's pretty impressive for any vaccine. In other words, if you got the second shot, I'm looking at the article in my hand now, they had about 40,000 people enrolled in the study, half of whom got a placebo or saline, not actual medication or vaccine, and half got the vaccine. And there were something like 192 people who got the placebo, got sick, or 162, and maybe 6 who got the COVID vaccine. So very high efficiency. They looked to see if you only got 1 shot, whether you were protected, and they could only do that in the weeks between the first shot and the second shot 3 weeks later. And they are giving a number of about 50% protection from 1 shot. Well, 95% is a whole lot better than 50%. That's why the second shot is part of the regimen that you need. But these other speakers, Dr. D'Angelo and Dr. Schlanker, will talk about side effects, so I'm not going to get into that. Anything else?
Dr. Farrer, Mary, can I ask him a question? Dr. Farrer, you and I talked a little bit about the flu. In the best of times, the flu protection is about what?
If we have a year when the flu shot is 50% effective, we think that's the greatest thing.
Yeah.
Often the flu shot is more like 25 or 30% effective. Now, if you get the flu and you've had the flu shot, often you have a milder case, but it's not preventing you from getting sick. This vaccine with 95% protection is much better than a flu shot.
So even after if I understood you correctly, even after the first dose, it's better than most flu vaccines in the best of
Right,
years.
but
Is that right?
But when people decide that they're going to get this vaccine, which I think they should, we want them to have 2 shots, not just 1.
Yeah.
But yes, there seemed to be about 50% protection even after just the first shot.
And you also taught me well, because the question I had for you was, why not just vaccinate with just 1 shot? And then your answer to me was a little bit about the virulence of this and the mortality of this disease, which I thought was a great
Too
answer.
many people that were so sick. We've seen too many people at Trinitas who have died from this infection. The more we can prevent, the better off. Also, if it prevents you from getting COVID, then you're not going to be out there infecting other people.
So, Dr. Shalankarel, we're already starting to get a lot of questions in the chat, and there's almost 260 people on the call. So tell us, what are the side effects and what is the overall safety of the vaccine?
Right. So all vaccines have side effects, but there's a difference between a side effect and an adverse effect. A side effect, like most vaccines, especially on this trial, we've seen that a quarter of the patients that actually received the vaccine, not the placebo, had a side effect, which included pain at the site of the shot, swelling of your arm, flu-like symptoms, but not truly the flu. And those are the issues that people had: redness on the site. And that occurs usually within the first 3 days, not so much after. We are looking at the people that had these side effects in the UK, which apparently is the study and the participation or population that we're watching. 3 or 4 of those patients in the UK that had these side effects were people that had known anaphylactic reactions to vaccines in the past. And interestingly, all of those people that had a very serious side effect in the UK all happen to also have an EpiPen in their hand. And if there are people that actually have epinephrine pens, then they know that they have issues with side effects. Now, I think that we can say if you have loss of smell, loss of taste, high-grade fevers, these are not associated with the vaccine. That's more for COVID. It does appear that people that are younger than older, so people that are younger than the age of 50, seem to get the pain, the fatigue for 1 to 3 days post-vaccine that maybe the over 60 population does not yet. And you have more pain with the second injection than the first injection. But there are ways to help with this issue. You can take Tylenol after you have these issues every 6 hours as needed. You can take ibuprofen, Aleve as pain and fever relievers. So those are some of the suggestions by the trial by Pfizer of how you can abate or make some of these symptoms go away afterwards. We actually have a 15-minute observation period following the use of the vaccine to make sure nobody has a reaction. If you have issues with anaphylaxis, not to vaccines, but to pills, medications, pollen, or food, and wait for 30 minutes post-injection so we can know.
Okay, thank you. And what about how does me getting the vaccine help the overall pandemic? I'm just one person in millions throughout the world.
Good question. So if I were to get the vaccine, which after reading this data, I do feel comfortable receiving the vaccine, then if I have a 95 or greater percent of not getting this infection 7 days after my second injection, then if I were to go on the wards, see COVID patients, I would have enough immunity to fight any infection that comes towards me, just as other vaccines have in the past, whether it be flu or pneumonia. We have enough immunity to fight the infection. So if I can prevent it from coming into my home and to people that I love nearby, then in effect, it'll soon reach the entire population. And that's what we hear a lot about, herd immunity or population immunity. Population immunity suggests that if enough people are able to fight off the virus, then we protect those that do not get the vaccine, which we've seen with polio vaccine in the past. So I think that's one way to protect myself, protect the people around me, those I love, my family members. And in theory, if this occurs over months, it should really pretty much prevent the infection from jumping from person to person, because we're able basically to kill the infection within ourselves.
So what about the people that had COVID already, or that might have had antibody testing and they have antibodies to COVID? Should they get the vaccine?
So that was a question that was actually answered by the Pfizer group. And they suggest that if you've ever had COVID, or if you've ever had a COVID infection, you most likely will not get the infection again 90 days after you have the infection. So they actually suggest that you get the vaccine at the 90th day or after your active infection. That also includes people that received convalescent plasma, if they did, or if they did receive a monoclonal antibody. Even those people should get the vaccine 90 days after receipt of this.
So let me ask you a follow-up question, Dr. Shalankril. If I get the vaccine, then why do I still need to wear a mask?
That's a good question. Because like we were talking about before, I'm only going to have immunity 7 days after the vaccine. I still have to protect the community, all the people around us, the population. And as we know, in the next few months, it's going to take time for the population to receive the vaccine. There are those that may not receive the vaccine, and we don't know how long this immunity is going to last for in theory as well. So we still have to protect the rest of the population and make sure that we wear masks. We have to make sure we use gloves and hand sanitizer. We have to actually watch the numbers of COVID cases go down over the course of the year to feel comfortable. And then it has to stay down for a long period of time until we remove all of these other measures. It's going to take time for herd immunity or population immunity to occur.
Great, thank you for that. Dr. D'Angelo, I'm going to move on to you. So what about, so now there are 290 people on this call, which is wonderful. I'm very happy that we're reaching so many people. Now there have to be individuals of childbearing age or pregnant women or people that have children on the call. So what about women of childbearing age or pregnancy and children and vaccine?
Yeah, I think so let me first just say thank you for having us on the call, and thank all of you for what you did and what you continue to do. There's a couple of knowns and unknowns, Mary. So what we know about this trial that most of us have in front of us is that we know about reactogenicity, what side effects that you're going to get, at least 2 months out, almost 3 months. We know about safety at 2 months or 3 months. What we don't know is about immunogenicity, meaning what is the durability of this vaccine with regards to both cellular and humoral immune response. And what we also don't know for certain, and I'm not going to say for certain after knowing what I know right now, the question is it safe? The trial for the 16 and under, my oldest daughter, I have 5 children, the oldest daughter would be eligible. She's 16 years of age. But would I give it to my 8-year-old, my 12-year-old, and my 14-year-old? My answer now is yes. But can I give you evidence to support that? I think we're going to know over time, but right now and this date, I can't tell you that I have the data to support that. I can tell you that historically, the spike proteins that present themselves with adenoviruses and other coronaviruses, that children, part of that is that their immune response to these viruses is robust, thankfully, and have been and continue to do well. I do think that it's reasonable to project that there are studies now ongoing within the world, including the United States, that will answer that question. So over time, I do believe by, third quarter of this year, we're going to have more robust data regarding pediatrics. But if someone said to me, John, right now, do you feel safe knowing what you know? The answer is yes, I do feel safe. I don't think we're going to have to answer that question until some time. With regard to pregnant patients, again, there's knowns and unknowns. And when we talk about medicine and science, we know the ravages of this disease. We know that it has taken more lives than even World War or our Great World War. So we know that. So the question I have for the group is, what we know in front of us with regards to safety, that this, in fact, we do believe is safe. Pregnancy. We have seen patients deliver prematurely. We have thankfully seen our patients do quite well who are pregnant. The American College of Obstetrics and Gynecologists, and Dr. Farrer and I were talking about this at lunch, boldly said that they would recommend it. Now, I don't know that any of the three physicians on here would come out and say at this point in time that yes, we would recommend. I would tell you that if my wife was pregnant at this time, that I would recommend it, because I know the ravages downstream to wife or a potential pregnant mother. So that's what we know right now, Mary.
Thank you, John. And I think that I would reemphasize when we talk about pregnancy, I would reemphasize what you said at the beginning of your answer, and that is the fact that because the trial started in the summer, and it's being said that even though it wasn't given to pregnant women specifically, they were not part of the trial, that there may have been women who were pregnant but didn't know it yet during that participated in the trial, and who will receive the vaccine now, so that we should start to get some information. But indeed, ACOG has put out a statement about the vaccine in pregnancy, and certainly asking pregnant women to have that conversation with their providers.
Mary, just another comment about immunogenicity and why we should be continuing to wear gloves and masks. This trial, to be clear, we know that it is successful for patients preventing the clinical syndrome. In other words, what the trial did was, and this is important for us to know so that we don't take our masks off too prematurely, so that we don't we don't stop our vigilance, is that we don't know, it said nothing about the asymptomatic patient. We think that it's good for preventing symptomatic patients, cough, fevers, chills, respiratory, but we do not know, and I think Dr. Farrer and Dr. Chlanko would agree, what it does with the asymptomatic. So let's not rush to take off our masks until the data comes back, and because we're not randomly sampling patients for the RT-PCR or the nose swab. That's not what this trial did, and that's very important for our community, for the nation, for the world to know. It's symptomatic patients we know that it is effective, but we do not know about the asymptomatic. I don't know, Dr. Farrer, do you want to comment on that?
Sure, John. I agree. They did not look at people's nasal swabs at 40,000 people every week. If you had symptoms consistent with COVID, they were testing and confirming that in fact you had COVID. What we do not know, because the study would be a very difficult study to perform, but it did not look at whether people might have gotten infected with COVID but not sick. So that's another reason, as both you and Dr. Chlanko have said, why we need to continue to wear masks and gloves and everything. In terms of pregnancy, the ACOG statement says that there should be a discussion between the woman and her doctor, and she has to decide whether the risks and benefit are worth it to her. I think that they made this without having the information, but there is no particular reason to believe that this vaccine would be harmful in pregnancy.
Yeah.
That's not the
Agreed.
same as saying it's been shown to be safe.
Yeah,
Right.
agreed.
It's not a live vaccine. There's no COVID in it. There is the COVID RNA in it, which has also been modified and blocked in a way that it can't do anything except what the vaccine is designed for it to do.
Right. So a question about severe allergic reaction, anaphylaxis, and people who have had to use EpiPens in the past. Can they take the vaccine? And should they take any type of preventative allergy vaccine before they get the vaccine itself?
So at this point, we should not be actually giving medication to prevent the vaccine. To prevent any side effects. Those people that have epinephrine pens, if you know exactly what your allergy is, whether you have, I saw some suggestions of angioedema, anaphylaxis to previous vaccines, there is an observation period. You should be mindful of these and please let the providers know prior to getting the vaccines. There is going to be a 30-minute observation period following this, and there are medications that you can take afterwards to prevent these type of side effects. But really, as a medical provider, I would tell you also that if you do know that you have an epinephrine pen and you are open with your providers, understand truly what your allergy is to. It's most likely not to the actual mRNA, the protein. It is probably to the stabilizing agent within the vaccine. So there's a real difference to that, because I think that was some people's concerns.
Yeah, I think that's a great point. I would just be careful. It's usually the diluent. It's usually the solution that causes the vaccine to be on the shelf for a long time, or in the refrigerator for a long time. And someone who treats vaccinations, allergic reactions, and anaphylaxis on a regular basis, please don't let the headlines deter you from getting this vaccine, because we treat allergic reactions and anaphylaxis every day in emergency departments across the country. That should not deter you. So be careful of a headline and really kind of ask your medical provider, hey, listen, is this safe? Particularly if you have underlying comorbid conditions, COPD and asthma. Those are exactly the patients that we want you to receive this vaccine.
Good. A couple of questions about long-term side effects and the safety of so I'm going to ask two questions in one: the long-term side effects and also the safety issues about the rapidity with which the vaccine was developed.
I'll try to address that. This study followed the patients for 2 months. They're going to continue to follow the patients who received the vaccine. At a certain point, very soon, those who got the placebo, the sham vaccine, it wouldn't be ethical to not give them the vaccine if it's so far been shown to be safe and effective. So they will not be able to infinitely follow the difference in what happened between the two groups, but they are going to continue to follow the patients who received it. Interestingly, nobody of the 20,000 that got the vaccine during the trial had these anaphylactoid reactions.
Yeah.
So I don't know how to explain a couple hundred people in England getting it and 2 or 3 already getting reactions. I can't, other than knowing that these were people that had EpiPens in their pockets already, which means they knew they were at high risk.
Right.
I do not believe that there's any preservative in the vaccine. I think someone posted is there mercury. The diluent is saline, normal saline.
Yeah.
And it's kept at minus 80 degrees in a freezer to keep it stable.
Yeah.
But I do
And
not
we're
believe there are
talking-
preservatives.
And we're, just to clarify, we're talking specifically about the Pfizer vaccine.
Pfizer vaccine.
Correct.
Right.
The Moderna vaccine can be in a regular freezer, and we don't have the amount of information. Someone also asked whether the side effect profile in the 2 trials was similar. Moderna hasn't published the study. I've seen some of the data. It looks like it's going to be a similar side effect profile, with the most common being sore arm, achiness, some fever, fatigue, that sort of thing, feeling like you're coming down with something. Are these side effects worse than the typical flu shot side effects? Probably. I wouldn't say it's less. It looks like it's a little more than what you get from a flu shot. But of course, COVID-19 is a much more serious infection than influenza. Not that influenza doesn't kill people. It does. But COVID-19 has killed over 300,000 people in the United States in less than a year. What was the second part of the question, Mary?
I'm sorry, so the long-term effect, I think you answered them both, Dr. Farrer.
Yeah, you
The
did.
long-term effects, and then also the rapidity of the creation of the vaccine. So you answered
The
both of those.
rapidity, as I said in the beginning, was done with appropriate scientific oversight, and the studies were done in a very strictly controlled way. What made it so fast was, first of all, we have technology that we didn't have 10 or 20 years ago, let alone years before that when many of the common childhood vaccines were developed. So we have technology to develop vaccines much faster. The companies and the government took a big wager. They bet that making millions of doses of the vaccine before you had it approved, or even starting to scale up vaccine production before you knew whether it was going to work, would pay off. And at least with these two vaccines, it has paid off. So rather than showing that it worked, getting the FDA to approve it, and then start developing, how am I going to make millions of these doses? It's already been done. So they did multiple steps that normally would be sequential. They did them simultaneously.
Good, thank you. Okay, so moving on in the questions, how often will we need to receive the vaccine? Will it be annually like the flu? We don't really know the answer to that question yet. That will come out as we go longer through the vaccination process. Dr. Farrer already spoke about the Moderna effectiveness versus the Pfizer, and that we really need for more time for that information to be published. Is there a concern about getting the COVID vaccine together with the flu shot? So they were all going, So I'm going to say, this is what I heard. And I did hear this on one of the calls from the CDC, is that it's not recommended that you get another vaccine within 14 days of the COVID vaccine. So because they don't really know what the interaction might be between the two vaccines, and you want to assure the effectiveness of both of them. So that is what the CDC recommendation was.
Agree.
I heard that Bell's palsy is a possible side effect. Is that true?
There were 4 cases of Bell's palsy reported in this study in patients who got the vaccine and none in the placebo. If you give 40,000 people shots, some of them are going to get almost anything. Some are going to have heart attacks, some are going to have strokes, some are going to have cancer. All of these things are possible. It is true that it's 4 versus 0, but the numbers are small. It was felt by the FDA panel that, I don't know if it was unanimously, but overwhelmingly voted for approval for emergency use of this vaccine, that this number of Bell's palsy cases was about what you might expect in the population over that period of time, and did not think that this was a safety signal.
Yeah, I agree. I think there is the difference between association and causality. You know, during COVID times, we wanted to cause, all heart attacks were related to COVID. Everything, but it's hard to prove causality. I think over time, we'll figure that out. We're going to go back and look retrospectively and say, could it have been? And I think over time there'll be some clarity there.
Okay. There are a lot more questions, and actually we only had 30 minutes for the call. there's a question about whether or not this vaccine may be mandated at some point in the future. Right now, we're saying that it's not mandatory. We don't know what the Department of Health or the government may mandate us to do as employers in the future. So I'm not really sure about that, but right now it's not mandatory. So for today, I want to say thank you, Dr. Shalankarel, Dr. Farah, Dr. D'Angelo. I think you all did a great job. The participants did a great job. There are great questions in the chat and still more great questions for us to answer. And I really do want to thank everybody for participating today. I think this was a great event for us and the first of others to come. So thank you very much, everybody. Take care.